Well, this feels different.
Yeah, normally we're just talking into microphones.
And now there's a camera in front of us, so you can see us.
We can't see you. No. We have to behave.
And we are not wearing pajamas when we do our podcast.
Let the secret out. Okay, but seriously.
Yeah, welcome to our podcast.
We wanted to create a space here where we can have a good conversation about some of the topics that matter most to us at Clinetix.
Yep, science, decision-making, trends.
New treatments, emotion, why we do it.
The behind the scenes, the reality, the outcomes, everything.
So let's get started.
Yeah, so if you are a patient or if you are a potential patient or an injector or just somebody who's interested, welcome to the podcast.
So the first thing we're going to talk about is the philosophy and clinical approach, what we do, why we do it, what we've learned along the journey.
So Simon and I come from a medical background. Simon was an ENT surgeon and I was a dentist before coming into medical aesthetics. We both worked in the NHS for over 15 years before moving full-time into aesthetics, and we've been practicing aesthetics now for over 20 years. We've seen a lot of changes in aesthetic medicine from when we began, and I think that because we've been in from the beginning, we've learned a lot along the way, and I think that it definitely differentiates our clinic from a lot of clinics in the United Kingdom for the better. And yeah, let's discuss.
Yeah, let's talk about that.
Things have been.
Well, let's start with the here and now. We don't need to talk about the history. We can,
okay.
We've done and dusted that 100 times, and I'm sure we'll come back to it again in the future. But why don't we talk about what our ethos is, what our philosophy is, what is our approach to patient care right now?
I think that our approach to patient care is always that the patient is the most important person in the equation, and that anything that we do for that patient is going to do them no harm, but also make sure that it has a positive influence on their health and on their psychological well-being and them as people. So, it's always been medically led. We've always listened to the patient, and I think that we always employ a really transparent journey, which begins with starting to build a relationship, assessing the patient, listening to the patient, creating a diagnosis and a treatment plan, and then actually working with the patient to agree a treatment that we're going to perform for that patient that's going to positively impact on the patient's health, their skin, and their general well-being.
Yeah. I agree with you completely. I mean, my take on this philosophy is, as Emma said, it's a patient-first approach, and it kind of it's a kind of a switch from this really traditional concept of what aesthetic medicine is. Aesthetic medicine being, is it Botox and fillers? Can I have this treatment to make me look better, get rid of lines and wrinkles? And we've not been like that, not for a very long time, if we ever were. The approach is, sure, the concern might be a line or a wrinkle, but there's a fundamental underlying reason for that. And our role as medical practitioners is to identify that reason and explore the whole journey. So we're interested in patients more who want to improve their appearance by virtue of improving their skin health, their soft tissues, the skin, the muscles, everything else that's associated with it. Now, the patients generally don't know that. They look in the mirror and they're not happy with what they see, but it's our role to get deeper into that and understand the anatomy, the physiology, everything that's gone on with the aging process, and tie that together with the emotional, psychological, and social picture that presents with the patient, and create a treatment plan or a treatment journey that has one treatment, 10 treatments, a lifetime's worth of treatments, but a process that works for the patient to get them from where they are to where they want to be and maintain that over time. And it's not an issue of freezing something or filling something. It's a lot more complicated than that.
And if patients who come to Clinetix either come to myself or Simon or Dr. Paula or Dr. Claire or Dr. Caroline or any of the therapists or any of the staff, I know that they're going to identify with this journey. And I know that my patients and your patients have been with us for 10, 15, 20 years. It's not about coming to a clinic. In fact, it's impossible to book into our clinic for a procedure. For example, botulinum toxin or Botox. You can't phone up and just say that I want to book in to have that treatment done. You must book in for a consultation and buy into that process that we need to assess you and what your needs are, and then come together to make that decision as to what's the treatment for you today, for the rest of the year, and for the next 5, 10, 15, 20 years of your life. And that's what's really unique about the relationship that I have with my patients, that they will come in and we've built up this trust, and they know that they don't really need to ask me for a treatment. They want to ask me what my advice is for that current time in their life. What should they be doing in order to maintain the results that we've achieved and continue those benefits and actually prevent any further deterioration in their skin health that's going to lead to those signs of aging that potentially patients are not that happy with. So yeah, that's I think that kind of really sums up our ethos. The other thing that I would say is that, you know, we've worked as a business really hard with our staff to ask them what their sort of values are, and we've used those values to create sort of a mission statement. And, you know, so all the staff have actually come up with these visions and values and mission statements, and they have all contributed to it. Therefore, they buy in to the same ideals that, you know, Simon and I have as a business. And ultimately, I think that it's, again, putting the patient in the center of the journey and making sure that they're the most important part of the equation at all times.
It's a cultural thing, isn't it? We have always firmly believed that aesthetic medicine is medicine first, medicine completely through and through. There's an element of cosmetic about it. The cosmetic is the component where, you know, obviously we're changing the appearance, but the reason for doing that is not a vanity-driven process. There's no vanity metrics. We talked a little bit there just about kind of I think there's a bit of patient journey, and, you know, they come and we have a conversation about what it is that they want. And I was thinking when you said that, the interesting thing for me, and probably for you, and I'm sure for the other practitioners as well, is that the patients don't come anymore asking for a specific treatment, or it's rare that they do. But when they do, it's quite common that the treatment they're asking is not the right treatment for them. Or, you know, after the conversation that we have, we'll often decide that, you know, actually we want something a bit more long-term. We don't need to get rid of a line or get rid of a wrinkle, but what we need to do is improve the health of the skin to improve the overall appearance, and that kind of addresses everything else. And the other thing that popped into my head is quite often the sort of outcome of the consultation is that we don't need treatment. We'll have patients coming, we'll have that conversation. At the end of the day, we can go, well, you know what? Maybe we could just park this for 6 months or 12 months. Maybe this isn't right for you right now. There's no rush to make a decision. And sometimes the things that people are thinking about are not the right things at all. And the answer is either a completely different treatment, different medical speciality, or no treatment at all.
Yeah, well, what I find, especially whenever new patients come to the clinic, is that they feel, because there's so much information out there on the internet and with AI, that they're responsible for finding out what treatment that they should get. And, you know, they might come up with, for example, that they need like a skin booster or something like that. And they come in thinking that that's what they're going to get done. But actually, that's what I like to do, is just say to the patient, look, forget about what treatment that it is that you want, because we can't really get to that point.
It's the outcome.
Until you just tell me what the outcome is that you want to get. And then I can help advise or direct towards treatments that might be suitable. Because essentially, you know, as I, you know, I may have already mentioned, we've got medical degrees and a dental degree, and we've like studied for a very, very long time to understand skin health.
We've been doing this
and
for 20 years.
treatments. So, it's very hard for somebody who doesn't have that medical understanding to pick a treatment. So what's more important is to come out in with an outcome, what you want to achieve, and then we can sort of help direct towards then the research that then you can go. But at the minute, there's just so much information out there, so much false information out there, so many influencers that can drive the want for a treatment, and that's really not the way in which we work at Clinetix. It's about what the outcome is, what you want to achieve today and in the future, and how you want to look after your skin. And ultimately, yes, you did talk about the cosmetic outcome is important for a lot of people. But the most important thing is making sure that your skin returns to like the best possible health. The skin is the canvas of the face and the neck. And if you've got healthy skin and if it functions well, it looks well, it glows, it is healthy, it is attractive. And essentially the key fact is not just applying the treatment, it's making sure that the skin is functionally healthy, and therefore you will get to the end goal of a really aesthetically pleasing appearance to the skin.
So our philosophy, lots of components to it. Patient first. Agree?
Agreed.
Outcome driven or goal orientated. We're not treatment orientated. Empathy, communication, understanding. We're
Relationship building.
Yeah.
Safety, patient safety. We invest heavily in things like ultrasound, videography, good quality medical products, and drugs, and training as well. I think is really important.
Yeah.
So.
Okay. So
I think that sums it up.
That sums it up. Is there a last message for this segment? I've got it. Don't go to an aesthetic clinic asking for a treatment. Go to an aesthetic clinic asking for advice about an outcome that you want to achieve.
Yep, and trust Clinetix.
Oh yeah, of course. We're the best.